I will talk about the rhinoplasty. The primary one means first surgery, and from the outside, there is four things in the surgical plan. First one is, as I said, nasal tip plasty, using the cartilage of the patient's own. And the second one, nasal bridge, usually by silicone implant. And the third one is the nasal bone. If the patient having the wide nasal bony bones, then we think about narrowing of the nasal bone. And I prepare the skull model. This part is nasal bone. So sometimes people having the wide nasal bone, then we do the osteotomy like this. Can you see? This is nasal model. If we see there is some cutting on both sides of nose. So if the width of the bridge is too wide, then we consider about the nasal osteotomy.
อ่า
And
ค่ะ
first one is the elevate. If it's too wide, then we can make it narrow. Okay. And from the outside, it's full, but inside there is the nose is also the breathing respiratory organ. So we have to think about the function of nasal breathing. So if there is some discomfort during the nasal breathing, then we have to think about the surgery to correct the nasal problem. And if it is secondary, which means not first time surgery, then we have to use another materials for the tip and dorsal area. The first one on the right side is the lip cartilage from the patient. Second one is the dermal fat graft from the buttock area. And third one is from the temporal fascia. And first one is the dermal graft from the groin area to cover the silicone implant, because secondary case having some problems inside the cartilage framework or the skin problem addressed. So like individualized application of various kind of cartilage and other materials from the patient own or the synthetic material. And this is a procedure of rhinoplasty. Next. And next. As you see, there is many steps, but usually for primary case, 1.5 hours. Among them, 1 hour is dedicated for the tip, and 30 minutes is dedicated for the dorsal area. So the time duration of operation is also shows tip is more important. And the next slide shows, as I said, like 10 years ago, the surgical procedure made a tip more stiff, but beautiful shape, but tip. But now it's changing. So we divide like the dorsal area and the tip area. So there is some buffering, and the tip is more movable nowadays.